Good afternoon. I'm Alan Boone, Director for AAST Board of Directors. Today I have with me Laura Lindley, immediate past president of AAST, and Brendan Duffy, board member. Today's topic, we're going to be talking about facing the future and the future of sleep technology and sleep technologists. What are newest members, our youngest generation, what do you feel that they are facing in the marketplace at this point?
Well, it's interesting. I've had the opportunity to do a lot of talking with members and non-members both, visiting different state sleep societies. And so I think regionally we're seeing that technologists that are entering the field have different challenges. But overwhelmingly, the messaging is that the patients that they're taking care of are more comprehensively ill. Mm-hmm. So the whole risk assessment and being able to manage these patients in the sleep lab is a conversation that I'm hearing state to state, region to region. And I think with the entry-level sleep technologists that they really need the ability to have critical thinking skills and to be able to understand how comorbid conditions can affect sleep disorders and really understanding the sleep distribution in general. So I think that critical thinking is something that there's a much bigger focus on that.
Brendan, you've got a considerable web presence. What are you hearing?
I think people realize that it's changing, so they're starting to look at ways they become more valuable to their team, and we're trying to promote that also. They're not at the point where they used to be, and I've said it many times where it's not just sleep disorders, we're talking now about orderly sleep. So we're stepping out of the sleep lab, doing home tests, doing different things, going into a cardiac area. So you have to really know a little bit more about each of the specialties.
So diversification in the effort to bring value.
Right.
Okay. How do you think people are approaching that?
You know, it's interesting because you have a varied educational background for a sleep technologist. And this is something that during my role on the board of the AAST, we've taken this very seriously. You know, back in 2013, we had the summit where we brought together key stakeholders in sleep. We brought together educators from the COA PSG. We brought members from the credentialing board. We brought in physicians. We brought in insurance plan administrators. And there was a lot of discussion on what does the future look like for a sleep technologist. And overwhelmingly was we have to respond to changes in healthcare delivery. And then, you know, you had the presence of home sleep testing. Also, we have the presence of outcomes management for our patients and becoming part of that chronic care continuum for patient care. So you almost had like a flip-flop where you have less technology, more management of the patient. And traditionally, a sleep technologist has been about that technology piece. You know, how do we get a clean acquisition? How do we get the data to the doctor? And now we're seeing the focus shifting.
But that is still a very valuable piece.
Absolutely.
Piece.
And it's
not the only one.
Exactly. And it's part of professional development and professional growth.
Right.
And so the AST followed that up with doing our survey in 2016 where we looked at what are the educational needs for technologists. And about 35% of the respondents agreed that a higher level education was needed, where we found 68% saying that we needed critical thinking skills, interpersonal skills, and the type of skill set that you would get with a higher education. So I think that the messaging that we're getting is that we need a higher education to promote our professional growth and our varied skill set.
So, kind of circling back around, how do you think a new tech, or even, for that matter, existent technologists would gain this knowledge? What advice would you give them?
Be thirsty. I mean, I've been doing it for 20 plus years, and I've learned just in the last week, people hit me with things that I didn't know, One of them, I'm not even sure the physicians, most of them know. So it's really nice that you can get to the information a lot easier than we used to, but you have to cull the information and you have to have that thirst to educate yourself. And if you're blessed to work in a hospital that's willing to pick up some of that tab, even better.
And know your sources for information.
Yeah.
Unfortunately, we hear all too often Dr. Google,
Yes.
which is not a good way to go through to find, always find information. So we need to make sure that we know where we're going for our sources. Laura, what would you suggest?
One of the things I think that we have to be mindful of is that ambulatory care is changing, and not just sleep. So it's the entire way we're delivering ambulatory care in this country. And when you look at our labor statistics, we have a 35% growth from 2006 to 2016 in ambulatory care delivery. That is projected to just continue to grow, and that's growing at a much faster pace than other labor groups. And so because of that, you're looking at who's delivering care. And we used to have, the centric care delivery where the physician was managing that patient. With the physician shortage, and specifically in sleep, this is a big issue, that we're rearranging whose role is what. And the sleep technologists absolutely can help gap that and help manage this patient if they do, as Brendan said, if they actually expand their skill set and become a critical part of patient management and not just getting that data to get a diagnosis.
Brendan, you're one of our newest board members. You've been with us now a year. Your honeymoon's over.
Thank you.
We've enjoyed having you aboard. Thank you. Again, you have a considerable web presence, and you speak to a lot of people on just your daily interaction. If you had somebody that came to you and said, how can I take, and we look at the opportunities and listen to what Laura's told us about, what role can I play in that? How would you advise them?
I actually have had a few people do that, and I tell them to jump in. Don't stand on the sidelines, because this society is all about all of us. And we only get stronger by having strong people throughout. So take advantage of everything that's there and volunteer where you can. Make some phone calls and do some work around what you do in your own place. A perfect example is this 2 days ago. I read an article. It was about somebody doing research in Texas on Alzheimer's and sleep. It's near and dear to my heart because of my mom. I wrote to her and told her a lot of the literature I had for her. She actually wrote back and asked if I knew any techs that might want to be in collaboration with the research that they're doing. So had I not taken the extra step to reach out to her, opportunities are lost. And that's the main thing that I would tell them is seek opportunities and volunteer.
Where do you see the profession going?
It's interesting because what I hear happening, you start hearing tidbits. The sleep technologist working in private practice, the sleep technologist working as a navigator in an inpatient setting, the sleep technologist working in academics, in research. And now you hear exciting things like athletics and wellness programs. And then, of course, the big opportunity here with telemedicine. And so I think that the sleep technologist role is going to continue to expand, and you have to get the right education to back that up and the right skill set to support it. It's the clinical thinking, it's the interpersonal skills. You have to have both sides of that coin. Early in my presidency, one of my most difficult conversations was when I was speaking with a physician group, and they said that we can't call you professionals, meaning sleep technologists, because we didn't have standardized education. And the hackles kind of go up because I've spent my entire career working with sleep. Now I had the respiratory background, went into sleep, but as a whole, because of the lack of an educational mandate, it keeps us from really truly fitting the definition of a professional. So that's something that the AAST has put out a strong position statement on this, that we feel we need a minimal of an associate's degree, And we're working with our credentialing boards to encourage them to adopt that for their eligibility pathways. I think it'll happen.
What role do you think the various types of social media has played in this?
I think it's been great. It's given a lot of different opinions, but you do have to watch what you put in the blender and see what comes out. So you do have to watch that kind of thing. But I think it's been great because I can get in touch. I can look. If somebody comes up with something that I'm not familiar with, I can go to the research and see what it's all about.
Mm-hmm.
So for me, it's a lot better than trucking to the library like you would have to do years ago.
Right.
I mean, so this is so much easier, and you do have access to people not only nationwide but worldwide.
Internationally.
So I've talked to Olympic performance coaches in Ireland, just because what they've seen I've posted. We've talked about different things. I've sent them information. So possibly, just from sitting in Long Island somewhere, maybe we influenced somebody on an Olympic team all the way in Ireland because he took this information.
So I think the key takeaway in that particular case is build that network and continue to cultivate that network.
Yeah, nurture it.
You know, it's not
Yeah.
just you watching what others are doing, but actually engaging and participating in that. What else do you think are the mitigating factors? What are the positive factors as we make these transitions?
I would just look for different opportunities. I know one of our doctors, you're talking about jobs outside the lab, she actually goes to employers like HBO and Bloomberg, and they do employee tapes. So that's something that a sleep tech could actually sit down and do themselves. It doesn't have to be a physician. It's sleep hygiene tips for employers, for employers and employees. So that's another opportunity to go out in the community and look at your shift workers, look at people who are traveling and have a long commute, and offer yourself to those companies and say, I'd like to come in and talk to your employees, because that's one of the biggest problems the employees have. If you Google, why can't I, sleep comes up. So a lot of people are asking that question.
It's amazing. But not everybody is necessarily a good public speaker. What advice would you give to them?
Well, there's other roles in the sleep lab, and when we look at outcomes management and we're looking at value-based medicine specifically, getting ahead of that and being able to know how to gather data and make sense of it. And so we need people to get in there and actually understand stats and figure out how is delivery of sleep medicine affecting their health system. I hear of several different initiatives, different types of initiatives, whether it's working with preoperative surgical risks or whether it's looking at readmission programs. And so there's different areas and different pain points within your health system that sleep should be able to be part of, get a seat at the table, look at where you can fit in to help other initiatives within the health system. And I think a big one of this is looking at the national health crisis of sleep restriction. And it doesn't even have to be anything more than helping get the message out of how much sleep is required in which part of your lifespan. And so, you can just look, it's just inserting yourself and reminding your health system that sleep has a role here.
With that, thank you both.
Thank you.
We very much appreciate your time and sharing your wealth of vast knowledge with all of us. And to the audience, I want to thank you for participating and watching. Please continue to watch the website for further editions of these series. With that, thank you.